We've been running about 1 out of 2 times a year that the family is able to join us in class. So take advantage of that and just, gather and learn all you can from that experience and kind of how it ties into Wonder and what that was like. And so just to kind of reframe your brains and get you focused on something other than answering 50 multiple choice questions, we're going to start with a free write. And if you remember, and I know, some of you don't like free writes, but I think it gets you focused on what we're going to be talking about. And basically, free writes are also good when you just don't know what to write or don't know what to say about something. So what I would like you to do is take out a piece of paper, or if you don't have paper, your laptop, or I have paper here if you'd like a piece of paper, and entertain the question, thinking about Augie and his family, so thinking about the experience of Augie and his family from the book Wonder, what nursing concerns do you have for them? And just to kind of think of it a little more in the context of this question, Augie is a newborn, Augie is a school-age child, Augie is an adolescent, kind of projecting a little bit. But what kind of just, free write, thinking about Augie and the family and our role as nurses, where does that intersect and what kind of thoughts come to mind? And I see people coming back both here and Twin Cities and in Rochester. So we'll let folks get settled and I'll just kind of go briefly through those instructions again. But did the folks in Rochester hear that? Those that were there?
No, sorry, they had gotten out just a little bit. They're about a minute. We're about a minute behind right now because you had said 25, and by our clock that wasn't enough time. By the time everything got turned in, and I counted the tests, so they're just coming back. So whatever you just said,
nothing got heard. Okay, that's fine. Yeah. We will start again. Welcome back, and. I had first kind of said that, we will be looking at the exam item by item and the statistics and the validity and reliability and all those kinds of good things before we post the grades. And then, certainly both you and I are available at both sites for whatever one-on-one the students might want to have following the exam. And then in order to kind of transition now, we're going to do some just talking and debriefing about the experience of reading the book Wonder and how that relates to our role as nurses and what our concerns might be. And then somewhere between about 10 o'clock or so, we are going to be joined by a family, the Copelands, and it will be Amanda, the mom, Brooke, her daughter, and her son, who's unfortunately, I don't know his name. I don't know if you remember his name, Sam. But they are a family with a child who has multiple health conditions, and Amanda is pretty much an open book. So just to kind of think about their experiencing, what their experience is like, because Amanda will just share pretty much anything and everything that we would like to know, and really feel free to ask questions. And both Dr. Summerness and I will facilitate that from both the sites that we're at. I think that catches everybody up. And then in order to just kind of reframe our brains and forget about answering 50 multiple choice questions and those kinds of things, we're going to start with a free write. And just remembering that free write kind of does focus our mind on certain questions and allows us to just, without editing and kind of being our own worst enemy and saying, oh, that's not a good thought, just write for 5 minutes about thinking about Augie and his family. What nursing concerns do we have for him or for them? And think about it if you want to, if it's easier to think about it at a certain stage of development for Augie. So what might it have been like for him as a birth and for them as when Augie was, an infant and a toddler? What might it be like for him as a school-age child or for them, which is really where the book takes us? Or as an adolescent, what concerns might we have for them? So we're going to do a free write. and then we will kind of open it up to a discussion for all of us. And we here in the Twin Cities have the view of the rest of our class that's in Rochester. And I don't know if you want to do the same or you want to keep looking at me. Either way is fine. But to have a pretty robust discussion of what it's like to have a family with a child that has multiple health conditions and concerns. And I will time us. Any questions before we get started?
Shortly, like what we're supposed to be writing, because I got really confused.
Excuse me?
Can you just summarize again one more time what we're supposed to be writing about? Because I felt like that was kind of long and I got really confused.
Thinking about Augie and his family, what nursing concerns do you have about them? Any other questions? All right, then, let's get started now. Okay, and stop. So who wants to give us a little refresher about just the overall plot of the book or what was going on? Kind of, if you would, what the history of Augie and his family is. Y'all read the book? Anybody in Rochester? We have a bunch of, blank stares here in Twin Cities. Although I'm sure I can call on someone. Okay, we've got somebody here. Can you guys hear? You here in Rochester?
Yes.
Okay.
Oh yeah, we can totally hear.
Okay.
I think they're all post-test too looking.
No.
Well.
A student was talking, and it seemed to me she was talking very softly, and I wanted to make sure you could hear what she was saying.
Oh no, we can't hear her. No,
okay.
We could hear you.
Great, speak up.
So the book follows the life of Augie's family, and Augie has a facial, it's like, I can't remember the long name of it. Mm-hmm. But it follows his life as he's starting 5th grade at a public school, Pageant of Hope school, up until then, and it's his adjustment to making friends, dealing with his self-image, and then also it shows the different perspectives of his parents and his sister and how Augie's condition affects their life.
Okay, who can pick that up, and what else? What other thoughts did you have about Augie and his family? Maybe somebody in Rochester pick it up.
Who wants to chat? Corey wants to chat.
Oh, okay.
I didn't hear what she said, so I can't really pick up what she said. But, my concern was the neglect of the sibling. She felt alone during this process. I mean, even though she was overprotective of her brother, but she's still her inner person. She was feeling like she kind of did things on her own, and she didn't want to hinder the family with her pettiness because she felt like her brother had better or bigger issues. So I think the sibling at times was jealous because everything was focused on Auggie, and that she didn't get, her mom and dad like most. She didn't get the full 100% because I think 80% of everything was geared around him. So any type of activity she had, it was almost 9 out of 10 times chances that her parents wasn't going to attend because Augie was always having some type of medical issue.
Okay, somebody here in Twin Cities, more about VIA, siblings, what that means to us as nurses.
Yeah. I would say that it'd be important for them to...
We need to speak up so that...
I'd say it'd be important for them to speak out to their parents if they are feeling neglected, as a nurse, to inform that, because I don't think the parents would intentionally probably try to treat them like that. And I know Via had her school play in the book, and she did tell her parents about it, and once she did, they wanted to go. So I think she might have in her head that it's all about Augie, but if she tries to open up and talk to them, I think that could help her too.
Okay, so how might we as nurses kind of help that process, or is it our role to help that process? When might we see this family? In what kind of circumstances?
He had a lot of surgeries throughout his life, and so he was constantly kind of always hospitalized, and for longer periods when he was recovering and stuff. And so I think that it'd be a good idea for nurses during that period to kind of set the family aside and take them one by one, ask them how it's going, and just making sure that they're coping with everything that's going on. If they need any guidance, if there's any part of their life that is difficult, just just to, like, let them know that we're there for, like, everything.
Okay, so how are things going as a family? And then, you know, if you had a chance to chat with Via along, which, as you say, when Augie was in the hospital, it's likely, given that family dynamic, that they were there a lot, right? So it could have been a situation where we could have said, you know, how are things with the family? And specifically ask, like, you know, what's going on with Via? How is she? Is she active in school, extracurricular activities? What kind of things is she doing? And then, yeah, support all the way around for each individual member of the family can be really important. See how they're coping. I don't think it's uncommon for siblings to kind of accept in some ways that this is the family and that this is my family dynamic. But just as when a new baby enters the household, it's kind of natural that there's a lot of focus around that newborn, but that there still are other children in the family that need to kind of still be taking part and incorporated into that family life. You know, thinking about maybe when Augie was born and what went on in the family then, what you know, might have helped or what might have hurt with that experience. Anybody in Rochester?
Oh, you didn't say. Okay. Can you repeat the question?
I have somebody here in Twin Cities, so we'll go with that and then we can pick up. I'm just looking to kind of get some conversation going. So if people have reactions to what students have said, please kind of just pick up and continue. But
I was just going to say that with like any chronic illness of a child, like there's always the option to like refer them to like a support group or group therapy so they can get other experiences or have an environment that they're able to talk about what's going on.
okay. The question was kind of what might that family environment been like when Augie was born?
How it changed.
Mm-hmm.
The environment changed.
Well, the daughter was like an only child, and she probably got a lot of attention because she was the only child, and she was healthy, and so the family and like the parents like only knew giving birth to like a healthy baby and like raising a healthy child, and then to have a baby who needs a lot of attention taken away from the older sister would kind of change that dynamic a little bit, and just like being able to understand the fact that they're going to need to be in the hospital a lot and like give a lot more attention to this baby.
Okay, so it was not only accepting, you know, kind of like integrating in a newborn into the family, but it was a newborn with needs that Via didn't have when she was born. So it was an adjustment for everyone, and maybe helping to kind of remind them that they still needed time for Via, because you don't know what that family dynamic or how that was incorporated, things like that. Good. What else do we think of?
I also kind of think like maybe with him being in the hospital so much with the surgeries, like did Via go with? Like did both parents go with and out of the hospital, or did one of them stay home? Or did she have like a babysitter all the time? Was she always with like grandma? You know, things like that.
Mm-hmm. Yeah. So how was that? You know, I think we talked a little bit about in the beginning of the semester, maybe even last year, about how families need to maintain an equilibrium. So when something like that happens, you're removing the infant from the home, and most likely at least one parent. Well, how is that balance maintained for the rest of the family? So yeah, being supportive and doing things like that. What else do people write about?
Just really quickly, I was just thinking too that with my 4 kids, just pretty normal family. with the differences in how the siblings change and how the interactions change with how you parent as each one comes. So without a chronic illness, right? And that's going to be, the dynamics change anyway. So Via could have had all of this anyway, a portion of this, right? Mm-hmm. As parents, I can say for myself, I really do try not to have any favorites. And I really am trying to do everything fairly. But as you know, if any of you have siblings and parents will say that life really isn't fair, and it is pretty hard to always give the same amount of money and always discipline the same way and do all that kind of thing. And I think that part of this book, when I read it, I kind of felt like as a parent, we all change in many ways. So over 20 years of parenting kids that I've had, I've definitely changed on how I parent, and my kids definitely can say that. I mean, rules change, how strict I am, it's that kind of environment. So it's already present within the family environment. But then a chronically ill child.
Listening. I think you froze. I don't know if you can hear us. We can't hear you. Oh, you're coming back. Slowly but surely, maybe? Can you hear us?
Oh, you couldn't hear me at all?
No, we totally missed from you said that you were treating each child differently, and as they grew and you changed as a parent.
Oh, okay. Well, everybody here said it was quite eloquent, so let me try to repeat that. I think what I'm trying to say is it changes normally. And I have changed as a parent over 20 years, and how I discipline has changed. So I think that's just something that happens in a normal family, but then with a chronically ill child, I think that's something that, adds on another layer. And her son will be able to really share this with us, that how that has changed, because he is an older sibling in his late teens, and he had a life that was different before Brookie came along. And he'll be able to say that. And then the other thought I had from all of you is, do any of you have any siblings that are chronically ill? And what have you experienced in that?
We do have one person here in Twin Cities that raised their hand, willing to share.
Yeah, I have two siblings with type 1 diabetes. They were diagnosed 2 weeks apart. And so I just remember, for a long time, I was, pretty young because they're older than me, but they kind of got it under control, and then by the time I was old enough to remember, they took pretty good care of themselves. But that's always been the number one concern. Whenever we're going on a hike, when we're on vacation, it's we have to go back because Ashley has low blood sugar, or do we have enough snacks, or who has all the insulin, or she lost her pump. That's always the biggest concern of our family. But I feel like saying that you're jealous, or I know you're jealous of attention, but it's not it's a different feeling. You're not jealous, you're just more concerned for them too.
Mm-hmm. Did you ever wish you had diabetes?
No.
Okay. No. I talked to a young, about 9-year-old with diabetes whose older sibling had it, and when he was first diagnosed, he was really excited because he was going to be able. And then he was and then when I realized everything I had to do and stuff, he says, yeah, it wasn't quite what I had wanted and what I thought it would be. But yeah, I think it is different, but I think, and then again, in all families, it's different too, just with how the condition is dealt with and how it's incorporated into that family dynamic. Anyone else? I don't know if I didn't see if there was anyone in Rochester. Okay, I see your hand in Rochester.
Sarah wants to chat.
Yeah.
I was just gonna say my stepson has autism and some learning disabilities. He's older, he's about 7 years older than my one daughter and 10 years older than the other. So when they were little, it wasn't a big deal, but at some point, both of my girls have kind of surpassed him cognitively. And so that's just been kind of a different dynamic, watching them go from the little, the younger sibling to not, being more of a caretaker role to him. Mm-hmm. And I just think it's made them more, and it's made them better people, more cognizant of differences in people, and have had to gently help him with stuff without making him feel bad. And,
Yeah. Yes, go ahead.
So growing up, I had rheumatoid arthritis, and prior to my diagnosis, I was like in and out of the hospital because I was always in pain, and my labs weren't really showing anything because I was so young, and I didn't really think it affected my brother too much, but he said it did because the parents were always going to the hospital with me, and like I'd be in the hospital for like weeks at a time, and then when I was diagnosed, I was on methotrexate, and I just remember always being sick, and I would miss school for like half the year because it just affected me so much in my immune system, and yeah, I think that affected my brother pretty bad. And then in high school, he got diagnosed with ulcerative colitis, and then ever since then, it has been kind of like a huge adjustment because anytime we try to travel or go out to eat or anything, it's just constantly like, what does he want? Like, what's up for him? Is he going to eat some food? Is he going to go on this vacation? Or like making sure we plan like stuff, like to go on road trips or anything. And he's developed like depression and anxiety and developed like a eating disorder because of it. So it's been kind of like a huge change in our family, but I wouldn't say like I was ever jealous of his condition. It was more of a concern and hope he gets better.
Yeah.
Mm-hmm.
Yeah. It's interesting how then you guys can now have a little bit of context now to talk about, really. I mean, it's a true example of selflessness, and I think at times it's hard to learn that in family. I mean, it's a great example of where we can, but I think at times there's so much angst between siblings, and just competition and all that. I think it's hard to actually experience a lot of that. And get what we need, but it sounds like you guys now can have conversations as you get older, even more so, and be able to support each other. Yeah.
Yeah. Anyone else? Does it matter whether it's an older or a younger sibling, do you think? How might those experiences be different?
If it's younger, you're already used to being an only child, and then you have to adjust, like we talked about, to getting a younger sibling, but also having a sick sibling. But if you're younger, you're born into this family who already is caring for a sick child, so you kind of just, that's how it's always been. It's still difficult, but in different ways, I think.
I think the age difference would make kind of a difference too. Because even if you're the oldest and you're like maybe 1 or 2 years older, you probably don't remember being an only child. But if it's like 5 or 6 years older, you're going to remember more of getting all the attention.
Okay, so there's some context to a family situation that also may kind of influence what's going on and how that family's reacting. Yes. Here.
So I think it's really nice to know how the other sibling react in those kind of situations in the novel, because I am one survivor, so I have a lot of, I experience all the reaction from other people. Sometimes I only think about myself, how people react to me, and not realize how maybe the other sibling feel about the situation. So I think that's, your situation also affects sibling.
And realizing, kind of having some other people realize that, because sometimes I think the individual realizes that it's.
Because I'm a burn survivor, so when I got burned when I was 5 years old, and after the incident, I have extensive scar on my upper chest. And as I grow older, the scar become tighter, so it kind of pulled my face down. So I went to school, and a lot of kids were staring at me and then talking, like calling my name. So all of those issues kind of like made me feel like similar to August feel.
Okay.
I think the novel is really, really relatable to me.
Well, that's nice to know, and thank you for that, because oftentimes, you know, the author of the book did not have a real-life experience within her family. So it's nice to know that there are points that it can be related, and it is relatable, but I think it certainly gives us a lot to think about. And I am so pleased to announce that our guests have arrived. So we're just going to kind of get lined up here, so maybe just take a quick 5-minute or so break to, again, just get up, and then we will resume once everybody's in place and we're sure the camera is on the folks we want to hear from the most. But I do welcome Amanda Brooke and Amanda and Brooke and
this is Austin.
Austin,
Yeah.
Okay, thank you. I was talking about you folks earlier and said, I don't know Brooke's brother's name. So Austin, it's good to have you here, and Mariana?
Mariana. Yeah, do you remember?
As our aide. So we have a unique situation here with this semester in that we've got kind of a classroom in two places. We have, you know, the group of students here in the Twin Cities, and then we have a group of students in Rochester, and Samantha is actually in Rochester with them, so I know.
Okay.
So we will all be interacting, and are just thrilled to have you here with us, and Brooke kept looking so good. So let's take about 5, we'll get everything set up, and then we'll come back.
How are you?
What do you have? Who's this? What's her name?
I did.
Yeah.
So we brought her because it's a long name.
I remember looking at it. I was worried for the other class.
I was like, oh, you're fine.
I probably should have like.
And then I was
Yeah, would you do better?
Haley's gonna like it.
It's cold now.
it's the only fun that
Where's the best spot for us?
Did you really?
Possibly kind of this close.
She wouldn't respond to it.
Do you remember Samantha? That's usually here. Do you remember Sam that's here sometimes too? She's going to be on the TV screen. I'll be able to wait on her. She's at another place. Yeah, she's in Rochester. Yeah. Two places there.
Did you? Oh,
Katie.
Did you go now study?
Yeah.
I saw you.
Yeah. Really? Yeah. It was
Okay. I'm just going to go back to the...
Yeah, I was like,
Hello?
Just like overpowers that.
Actually, I don't think you have. Okay.
I thought about it. They were fine. I know, I drank so. You know, the ones that like carry backpacks around when you're like throwing off.
Oh, what?
I like turtles.
I just like.
Yeah, I'm like, I don't.
Then I like reached out.
But yeah, I didn't do it like traditional. Close your eyes. Yeah. I have them.
Like looking up?
As a sugar.
Looking up.
It was last time. I just got
like twice. Yeah, eyes like I wasn't like that. I was just kind of like 40 coconut. I went around the cancer.
Just like random. Yeah. Like a third coconut and a regular third. Never. Jordan's friend is like the Red Bull girl.
I was getting halfway through this. I always have to sit like this because like my eyes tend to like go back and forth, and I rub it all my like. My head is had like on the bubble sheet I was on 8 and I was like, what happened? I was like, how did I miss this? I don't think I've ever like don't ever I've coffee. Did you? Yes. I filled the whole entire section and then I got how do you mess that up? Wrong section. So there were like 5 minutes left and like still have combination. Yeah. Then it kind of quickly transferred. Pretty sure that these two really count your hair. Proportions. You like talk about not a ton. That's my new oh, are you getting that? Oh my god. Yeah, no, yesterday I opened it. I could. Yeah, it's been a while. It has, yeah. Then I bought an HD micrometer, plugged in my That's how you had to do it. That was really yeah, wow. That's what it was. No, me neither. I've been like, oh, it's broken.
So then on Thursday, I tried to 4:30 and again. So like the whole afternoon. Bring it in. Wow.
We pretty much back in Rochester?
Yes, we are.
Okay. And so, as I said earlier, I'm thrilled to have the Copelands here and to hear their experiences as a family and what's been going on in the last. We were just talking, and I think it's been about 1.5 years since I've seen them. And Brooke certainly has grown up. Lot bigger than she was the last time I saw them. But without further ado, I'll let Amanda start. And I would just ask in Rochester, if you're having trouble hearing, let us know. We're going to be using the overhead mics, and we think that'll be sufficient. But if it's not, we have a handheld here we can go to. And if anybody has questions, I think we'll take them at any time. So we're certainly looking forward to hearing from you. Thank you for being here.
Yeah, thank you. All right, my name is Amanda. This is my daughter, Brooke. This is one of her big brothers, Austin. And down here is one of her home care nurses, Marina. I know we came to just kind of talk about Brooke and our experiences having a special needs child. I'll kind of just tell you a little bit of her backstory first, and then I kind of just do an open forum, and you can just ask me anything you want. Nothing is off topic. You can ask anything at all. So Brooke came to us at 34 and a half weeks. I developed severe preeclampsia, and so she was an emergency C-section. She ended up in the level 2 nursery with just some feeding issues and also pneumonia. She was in the level 2 nursery for a couple of weeks and then was discharged home. At that time, people kind of started coming over and visiting, and I remember we were home and it was day 2 of being home, and I had this just overwhelming feeling that something wasn't right. But I was kind of questioning myself because I was like, well, maybe it's just because she just got out of a level 2 nursery, and I thought I was just kind of freaking out a little bit. So I called my husband, and he's like, well, we have insurance for a reason. Take her in. And luckily I did. She had urosepsis. So she had grade 5 vesicoureteral reflux. So basically her urine was refluxing into her kidneys, and we had no clue about that. It should have been something that was caught on the 20-week ultrasound, but was missed for some reason. So she ended up back in the hospital, and at that point was transferred over to Children's NICU. She was pretty sick for quite a while. I think we were in, for the first 3 months of her life, she was in the hospital. Again, discharged home, and we kind of just kept being readmitted with pylos all the time. She constantly had kidney infections. So we got to the point where she was about 8 months old, and that was her first surgery, and she had a reimplantation surgery, so they took her ureters and moved them up on the bladder to try to decrease the reflux. We got to that 15-month mark, and I still kind of, I knew we had so many hospitalizations. We'd get done with a round of antibiotics, she'd be back in 2 weeks later. So we were constantly in the hospital. So she was really delayed. And I kind of started questioning, at that point we were just seeing a family practice doctor, and I kind of started questioning because I could kind of just set her on the floor and she wouldn't move. I could set her in the square, she'd stay in the square. And the doctor was like, well, she's had a lot of hospitalizations, and kind of just attributed it to that. He goes, let's wait till 18 months, see where she's at that time. So we got to 18 months old, still no progress anywhere, could set her on the floor, and she wasn't even to a point where she could sit up yet. So that's when we kind of started digging a little deeper. He went down and talked to the pediatricians who wanted us to go see neurology. So neurology was our first specialist. They came in, again, when she was 18 months old. They did tons of tests. I can't even tell you what they did. The main one, which is where we found out her diagnosis, was the chromosome testing. So she actually is the only one in the world with her chromosome disorder, and it's because she has so many chromosome disorders in one. So there's no name for it. I'll blurt off what it is, but she has 45 chromosomes with an unbalanced translocation between chromosome 5 and 14. She has one whole deleted chromosome 14 and additional deletions at 5p 15.33 and 14q 11.2. So that's like her umbrella diagnosis. After we got that diagnosis, then all of the specialists started coming in. She has, I think we're up to 16 specialists at this point. And then more diagnoses came in because that's when they start testing for things and looking for other issues. So she has a neurogenic bowel and bladder. She has a bicuspid aortic valve. She has hypotonia. She had failure to thrive at one point, so she has a feeding tube. She has a port, as you can see. She has a PICC line right now as well. Our most recent hospitalization was just a little less than a month ago, where she developed a Lyme infection. And whenever her body has to work on fixing something else, her gut just shuts down. She gets an ileus. She could have a cold and she'll get an ileus. So then that causes us to have to put her on TPN and lipids. So she's currently on TPN and lipids. We're almost at goal, though, hoping to pull the PICC on Friday. She's had about 64 surgeries. I've kind of lost count, but somewhere around there, 65. She has another pretty big surgery coming up on June 21st, so we're somewhere around like 66 surgeries, probably 10 of them being like major surgeries. Yeah, what else should we talk about? I did bring this doll, and I'm kind of bummed. I wish I could send this to you guys too, but I've never done this before, but I thought it was kind of a good idea. So this is what Brooke's tummy looks like. She has, I'll hold it up, and then I'll kind of pass it around too so you guys can look.
Can we get a close-up of Amanda at this point to maybe see the doll a little bit closer? Thank you.
It's so clever that they can do that. It pixelates stuff.
Yeah, because I'll pass it around to you
It'll
guys.
settle down. It'll settle down.
Okay, so she has the port on her upper right chest. She has an ACE. So a lot of this stuff, I don't know if it's new to you, you may not. It's new to some of the nurses that are even experienced in the hospital. The ACE is where we do enemas. So we're able to do an enema right through the cecum rather than doing it from down below. So that has been life-changing for her. She has a mitrophanol, which is where we actually cath her through. Mm-hmm. She has a separate G and J tube. So she doesn't have your typical GJ tube. She has a separate G, which is vented 24/7 usually because her stomach just doesn't really handle food in it very well. And then she has a separate J tube. So this is actually, it's called a Roux-en-Y jejunostomy. So typically with like your regular GJ tube, you would have just one button, and then you have kind of that catheter that goes into the jejunum. With her, she wasn't handling, because in order to do that, it has to pass through the pylorus. She wasn't handling something with her pylorus. It was not happy. So she was constantly like able to barf out that catheter, and it would be in her stomach, and it was a nightmare. So I actually did a bunch of research just to see how we could fix that solution so we didn't keep having to put her into interventional radiology to have a GJ placed again. So I ended up finding this Roux-en-Y jejunostomy. It's not very common. You won't see it a lot. I know hundreds of special needs parents, and I know one other person that kiddo has this. So I'll go ahead and pass this around to kind of get to,
I'm going to take a picture of it.
Oh, okay, that's a good idea. Yeah. So, I mean, at this point, I can kind of just open it up to questions. And again, nothing is off topic. She's been very life-changing for us. We've had a lot of ups and downs. We've almost lost her a couple times, and it's brought our family. It broke us apart for a little bit. My husband and I were separated for about 6 months, and she happened to be in the hospital and very ill at that time. She actually had a complete bowel obstruction. So, we've filed bankruptcy. We've lost our house. We're in a house now. This was right after her birth. We ended up losing our home because she was in the NICU and I wasn't working and having to take care of her. And so we've been through a lot. So when I say nothing's off topic, please ask me anything at all, because it's the best time to do it for you guys to kind of get an insight of what it's like for a family. So, yeah, I'll just open it up to questions now.
And you can ask me any questions as well if you need to.
Yeah.
I guess for you, like, do you have a background in the medical field, or did you just like learn all this?
I was a nursing assistant. Crazily, my dream job was always to be a registered nurse. I never made it there. We started our family pretty young. My oldest is actually 19. So I was 19 when I had him. So we started pretty young, and I just never ended up getting into nursing school. So I always just say I'm a nurse without the degree and the pay. Because all of her, all of her port cares, her PICC line, I mix all of her TPN at home. I do all of that at home myself. Like I said, she had just gotten, we're just clearing a line infection right now, so I was running IV antibiotics and everything at home myself, which has been life-changing for us, because we used to do all of that in the hospital, and finally I kind of advocated for myself and was like, okay, I can't spend months in the hospital on TPN and lipids. Let us do this at home. Teach me how to do this at home. So we're usually in the hospital. It hasn't been more than about 10 days at a time at this point, and then I just do everything at home. And I have the support of my home care nurses too that help me out a lot. I do a majority of her IV stuff though, just so less hands touching. Oh, yeah.
I have a question for both you and Austin. So, how do you balance? Obviously, Brooke can take up a lot of work, like you were saying, a lot of work and a lot of time spent with her. Just how do you balance that, having other kids to take care of, and then Austin, how do you feel like it's balanced, or how do you deal with having a sister that's pretty sick and needs a lot of attention?
I usually, when she's in the hospital, I will usually stay up there, and I usually spend the weekends up there if she's over weekends. And I feel like it's all balanced, because usually when she's doing her medical stuff, I'll go in there and help her, make her laugh so that she's distracted from all of it.
Yeah, and I try to, because both my boys do sports. My oldest is now graduated from high school, but he plays hockey and lacrosse, and it's time consuming. So unfortunately, a lot of the time, my husband and I, depending on her level of illness, we just kind of separate and have to, he manages the boys, I manage her. If she's in a good place and isn't too ill, then I always try to make it to their games. I've gotten to a point where the hospital is honestly home away from home for us. The nurses are literally our family. I mean, they know us when we get there, so I've gotten to a place now where I'm comfortable leaving the hospital and know that she'll be well cared for because, the nurses know her so well. And just your guys' role as nurses, honestly, is top to us. It's your guys, you matter. So, not that doctors don't matter. We love doctors. But you guys are always the ones who are right there. And, for our family, nursing is obviously very special, and where you guys are always our first line of any defense and stuff like that. And you guys always can pick up on stuff because you're directly in care with our kids. So you mean a lot to us. Anybody else?
What's your experience finding home health care? Because I know for a lot of people who need full-time, I don't know if you guys need full-time home health care, but it's really challenging and it's oftentimes not affordable. Mm-hmm. But yeah, I guess I'm just wondering what your experience is with that.
So I actually did everything by myself for the first 7 years. I had a friend who kept saying, "You need to get assessed for home care nursing. You need to get her." I was like, "She won't qualify." I'm like, "It's fine, Well, she ended up qualifying for 24/7 care, which is what she needs. Overnight, she's on pulse ox, CPAP feedings. So home health care's, been up and down. We're at a really good point right now where all of my shifts are covered. And what we ended up deciding to do as a family is we decided to have our nurses there during the day until about 6 o'clock in the evening, and then I do all the overnight stuff. So I do all the waking up in the middle of the night when she alarms and stuff like that. As far as affording it, so we actually have a waiver through the county. So a nurse from the county comes out and assesses your child's needs, and then based on whatever the needs are, gives you X amount of dollars for nursing. So we pay all of our nursing out of that waiver, and then whatever is left is stuff that we can get for her that isn't typically covered under insurance. So with all of her tubes that you'll see, there's obviously a lot of leaking, so they cover clothes for her. I just had our house remodeled to be handicap accessible. So basically, this is harsh but sad, but I have to say it because it's just the best way to put it. The county wants us to keep her, right? Because if I said, no, I don't want to take care of her, then she wouldn't even be able to be in the system because she's too complex. She'd have to be in a hospital. So they really try, at least in Anoka County. I'm in Anoka County. All counties are kind of different. At least they really try to provide us with everything that we need to remain at home and in the home. So I've been okay with nursing, but there's been times where it's been a little rough and rocky, but at the moment I'm good.
Are you through a specific program then for nursing?
We actually, my company is Beata. So there are a lot of them out there, but we're specifically with Beata right now. I put her shirt back on. Anybody else?
So what does transportation look like getting her here today and
So actually that was another thing that the county paid for is I bought just like a regular minivan, and it was adapted with a ramp. So I have a ramp that actually, so she can actually be seat belted in to her chair. This has a chest strap on it. I know you guys can't see down there, but and then she has things here. So I have, they're like tie downs basically. I can lock her chair to the floor in place in the van. So we just roll her on up there, and yeah. Before we had that, we did just have like a manual wheelchair, and I was having to lift the wheelchair in the van all the time, and before we had the ramp.
That was bad.
Yeah. It was getting hard on the back, for sure.
We have a ramp.
We have a ramp, yeah. We have a ramp.
I see some hands in Rochester,
Yeah.
So let's go there.
I just wonder what a typical day looks like for her.
So Brookie does half days of school because of all of her cares in the morning. There was one point we tried to do it in the evenings, but then I was having to miss, sports and stuff. So we start her day off at about 8 a.m. And on an ACE flush day, which is every other day, we have to, I shouldn't say we, a majority of the time the nurses are doing all this stuff, but we have to mix all of her ACE stuff, get that ready to go. Prior to that, just getting her up in the morning. She also has arthritis, so it's really, mornings are tough on her. She's really swollen and just, a lot of edema in her feet and hands, and so we kind of have to try to give her a little bit in the morning to get moving. So we do ACE, and then all those tubes, there's a lot of tube cares. I keep her tubes beautiful. We get compliments on her tubes all the time. So we keep them clean. So it's a lot of like cleaning that and getting her moving, and the ACE flush, and She's hooked up to a Foley overnight as well to drain her bladder. We have to do bladder irrigations because when you're not urinating from below, you're at higher risk of kidney stones and crystallization because all of that just kind of sits at the bottom of your bladder. So we have to do irrigations of her bladder as well just to get the mucus kind of moving and out of there. And because her mitrophanol tract is actually created out of bowel, it's actually more mucousy. They typically create it out of an appendix, but she had an appendectomy when she was 3. So we have that tract created out of bowel. So it's a little bit more mucousy than like your typical bladder would be. So it's just it's a lot of medical cares. A lot of medical cares.
During your pregnancy, were you aware that Brooke would have like any of these like diagnoses, or were they kind of a surprise? Like once you had her, and like how were you able to cope?
It was a complete surprise. So the 20-week ultrasound, they had said everything looked normal. She actually has a duplicating ureter as well on her right ureter, which they missed. So, which is the main reason why she ended up getting that vesicoureteral reflux. We had no clue. I didn't find out until she was 18 months old. And I basically found out with a phone call that said, here's what we found. She has a chromosome disorder. We can't get you into genetics for 3 months. So, of course, what do? Go to Google. And I start Googling chromosome 5, chromosome 14, and, I'm getting cancer and this and that. And I'm like, it was shocking. Like, I can't even explain it. I didn't know how to process it. And, when you find out something like that and just to not have the literature to back it up is the hardest thing that I've probably ever gone through with her, because you just want those answers. You get this diagnosis and you're basically left with, okay, you can see the doctor and ask questions in a few months, So that was the hardest part for me. Her other diagnoses, at least I can, find information out and Google it and whatever, but just being with the only one in the world with the chromosome disorder, I couldn't find anything.
Hi, Amanda.
Hi.
Sam.
Hi, how are you?
Good to see you.
Hi, there's Sam.
Fantastic. Yeah.
You see her?
Yeah. So, we talk a lot about the hospitalizations and the surgeries. I thought from the context of, I bet you it's a little bit like when she's this age, this surgery, and when this happens, this, but is there, because we don't know exactly how it plays out, how longevity looks like, all that kind of thing, how do they determine, like, in June you're going to have another surgery, how do they determine the next right step? And I'm sure infection plays a role, because you glossed over that, you told us, but boy, we know how hard it's been for you and how often she is in the hospital for different infections and different things. So I'm wondering if you can just share that perspective. You're a very strong woman, and I know you've been through a lot, so we just want to hear just that, all that has entailed. So even from Austin's, I want to hear from Austin as well, in terms of his perspective and how hard it is for him with mom gone and dad and things like that. So, big question.
Yeah, the surgeries and the time away from the family is, it's hard. In the beginning, it was probably more hard than it is now. We've kind of it's become a part of our life. But in the beginning, and Austin actually, I don't know if I've ever even told him this, but just to normalize life for my boys, in the beginning when she was in the NICU, I used to go to the hospital while they were sleeping overnight, so they had no clue I was gone. I would get back home. I know. Obviously, I haven't told him this. I would get back home to get the boys on the bus, and then I would leave, get myself showered, go back to the hospital. I'd come back home again before they got off the bus, so they never knew I was gone, eat dinner with them, and get them to bed and go back to the hospital again. So they really had no clue. So in the beginning, I was just trying to not change their life. Now, obviously, we got to a point where I wasn't able to do that anymore because they were getting older, and her surgeries have never really been, there hasn't been really like a planned set, like this is what's happening. It's kind of just happened. Her other, major surgeries were she had a bilateral femoral and tibial derotation. That was a really rough one. She was in, double cast with a bar in between, and you remember that one? Yeah. It's just it's hard on a family, and the fact that my husband and I made it so long without a separation, I'm not gonna lie, I was shocked we made it as long as we did without a separation. It's you get married and have kids to have a family and to have that unity and to be together all the time and support each other, and not that we were nothing but supportive to each other, but you lose that connection with your husband, and it was a very devastating time on the boys, I don't usually want to talk about that at all.
Sure, that was probably like the hardest time in my life because I didn't know where I wanted to go, because I'd usually want to stay with my mom because my dad was living with another family. And when he got his apartment, that was when I felt more comfortable going over there because my dad used to snore really loud before he got sleep. I'd be up till 3 a.m. listening to that. And there was one time where I ended up calling her at 3 in the morning asking to pick me up because I couldn't sleep. And the next morning my dad said, "You need to just wake me up and tell me that I was snoring." We're just supposed to sleep on the couch, and I was like, "Yeah, I know." And I felt, that was probably hard for me. And just being gone from these two, because Brooke never really went over to the place where my dad was living because she had to stay with her for all her medical cares. It was hard being away from them. And it would usually be stay on the weekdays with her, go to my dad's place for the weekend, and then stay a full week with her. So I wouldn't see my dad as often, which sucked as well. But when it was all over, when we were all back together as a family, I felt a lot more comfortable. And it was just easier for me.
It's hard. It's hard. It tears me up, but it's life, and we've overcome that. But knowing as many special needs families as I do, 90% of them do not overcome what we've overcome and have been able to work everything out and get back together. It's so hard. And there was a while there that she was just, in the hospital all the time. And when I say all the time, I mean monthly for a couple weeks at a time, and then home for a week or two, and then back in the hospital again for a month at a time. It's very, very hard. Very hard.
Pretty sure that was in 2015 when she was in there for
that was
250 plus days in the hospital.
There was one year. Yeah, I think he's right. It was about 2015. She spent 250 plus days. 50 plus days in the hospital. So, and my kids, my boys are just amazing. They've adapted really well. Sometimes, I always wondered if they didn't talk about it, but I always left that communication open, that if they ever needed to say anything that they wanted to, they would. He's probably a little better about talking about his feelings and stuff like that than my older one is. My older one he kept to himself a little more often, and he's a swimmer. He kind of pushed himself into swimming and just, really focused on that. But yeah, sorry I get teared up, but this is our life. So, right.
Yeah. Go ahead.
So when you said that
Rochester, a question in Rochester.
Okay.
you said that 90% of families don't overcome what you guys did. What do you think it is about your family that allowed you to do that?
I heard 90% of families don't overcome, and then I didn't hear you after that.
Overcome. What do you think it is about your family that allowed you to overcome?
Yeah, I think.
What did Austin say?
I said I feel like it was my dad. He would always text her things, and I remember you saying the one thing that brought you guys back together was when he said he heard this song by John Legend. I forgot what it was called. He said, "This song reminds me of you all the time, every time I listen to it." And she said that that's what brought them back together.
It was a little bit more than that. That's the whole story that I heard. What does that mean? It was just a song. I think it really just forced my husband and I into communicating better with each other, and that's honestly, the communication piece, and I know it's cliche, you hear that all the time, but it really was just the fact that I think we were just kind of going through the motions of having a sick child, and we weren't ever really talking about our relationship and the effects that had on our relationship, and we just, honestly, the separation was the best thing that ever happened to us, and I wish other families could say that, but it just got to a point where it's okay, we need to talk about our life. Our life isn't normal, but it had become just such a normal to us that we just went through the motions, so that really made us, our communication better. And if he's pissing me off, I tell him he's pissing me off, which I used to just kind of brush it off and whatever. And yeah, we've been really strong now. We piss each other off a lot now, but it's okay.
Did you have any support during that time? Did you go into therapy, or was that your own kind of solutions?
We actually, prior to our separation, did attempt to go to couples counseling, but we did. We did. I think I was closed-minded. I wanted nothing to do with it. And I think what made me so closed-minded to it is the fact that I had brought up multiple times that I thought that we needed to go to counseling, we should go to counseling, and he was always against it and wanted nothing to do with it. So then we had gotten to this point where I was ready to be done, and I was the one who initiated the separation. I was done. My feelings were, dwindling, and the fact that I had tried so hard to get him to go into counseling and he was so against it, that finally we got to this last step, and he, was begging me. And, my husband and I have been together since high school, which also isn't easy. We've grown up together, we've changed, and then to have a special needs child thrown into all of that when we're still growing up, it's not easy. So we got to this point where I was then done, and I felt, okay, well, we've been together for, I think at the point of our separation, we were together for 17 years. No, 15 years maybe. And I was like, okay, I suppose, I should at least give him something. And so I tried, but I think I was so closed-minded to it that it didn't matter at that point anymore for me. I think so during that time where we had made the decision to separate was just prior to her ACE and her Mitrophanov surgery, which was done together. That was a tough time, being this huge surgery and we're separated and now we have to sit in this room together and try to be okay with each other. My what? Oh, yeah. But it just, it's crazy to think back on all of that. But I don't think we would have been separated as long if she didn't end up getting a bowel obstruction from that surgery. So my mind was closed off to even working on a relationship. My whole mind, body was getting her better. And that bowel obstruction was it was a nasty, nasty one, and she was in tons of pain, and we were in the hospital at that point for 3 months straight. We didn't go home 3 months straight. And that was right in the middle of our separation. So I think I would have been a little more open-minded to talking about our relationship and getting back together if I wasn't going through everything that I was with her, because I didn't leave the hospital. I was just with her. So I think, sorry, I know she had a question back there.
Question here in Twin City.
Okay.
Yeah, I was just wondering if you and your husband were able, like how your job situation was, were you able to work full-time, part-time, like how was that over the course of Brooke's life?
When I was pregnant with her, that's when I was working in the nursing home. I was a nursing assistant. I got taken out of work because my blood pressure was starting to be an issue. Went back to work. I actually waitressed at Olive Garden for like 10 years. And I got to a point where she was about 3 years old, and I couldn't work anymore. I was calling in to work all the time because she was in the hospital, or we had appointments and unexpected appointments, and it basically, the boss came to me and said, you got to quit or I have to fire you, because at the end of the day they do have a business to run, and it was unfortunate that it ended that way, but it was impossible for me to work. And it wasn't till about she was 5 or 6, I think, that the hard part too is like just finding all these services. They don't talk about all of these services with families very well. It is me doing research and finding this stuff. But now I got to a point where when she was 5, I think is when we had her first county assessment basically. And now I pay myself as her PCA basically. So that's how I pay myself. And I don't work anymore. Just it's too many appointments and too many hospitalizations, and yeah.
What do you do to take care of yourself? How do you keep your stress down and keep yourself healthy?
I play bingo. I do try to. I will admit I have a hard time. I think because I managed her medical care for so long, I have a hard time separating myself from managing her medical care over the nurses. I'm still very overhead on everything. So I'm not the best at taking care of myself still, I will admit that. My husband does really try to push me to do that, and I know that I need to do that. Yeah, at the hospital. That's kind of another hard part. My husband had a trip to Arizona last month, and he really wanted me to go with him, and I have a really hard time separating myself from her because of anything can happen at any time. So I got to this point where finally I was like, okay, I can leave her with the home care nurses. She'll be fine. I'll book this flight. But I ended up chickening out. Well, during that time is when she got that Lyme infection. So it's so hard, it sucks for my husband and I because, we want that relationship. We're at a point in our lives where we should be able to leave her with the babysitter and go do something, but we can't leave her with the babysitter. A babysitter can't handle her. They would not know what to do with all of that. So I'm trying to get a little bit better about scheduling nurses, one evening every month to 2 months where we can, my husband and I can go out and do something. I've been playing bingo more often with my girlfriends. I feel old now. So, Coach First Bingo. So I've been trying to do that, which helps me just get away and have fun and not have to worry about anything for a little bit. But yes, I still very much manage the nurses. Yeah.
I have a question for Austin.
Yeah.
It seems like you guys have a really strong relationship. Like, what do you like to do with Brooke?
When we're at home, I will usually ask her if she wants to come in my room. Usually it's a no, but when it happens, we'll both just chill in my room. I'll probably be playing my PS4 while she's sitting on her iPad. We both just kind of chill on the couch. I'll watch her, then I'll just do stuff with her. And
we like to fight.
We like to fight. What's our favorite thing to do at the YMCA? We like to go to the splash pad at the Coon Rapids YMCA in summertime and stuff. Take it on the slides.
Austin's amazing with her. He really is. I think, not that my oldest one isn't. He's just older. He's, 19. They're closer in age. And Austin is truly amazing with her. If she's having a hard time, all I have to do is go grab him and, he's able to just redirect her and get her to, during her medical cares. I mean, this poor girl has somebody coming at her all day, every day, because she's catheterized every 2 hours and meds and feeds and, he's able to just distract her, and he's really amazing. He really is. I probably don't tell him that enough, but he really is.
I know this is going to kind of sound harsh, but the way I distract her is I will let her beat me up, and then I act like I'm hurt. And then she just starts dying in laughing.
Real life.
All right.
Austin, because of all the exposure that you've had between hospital stays and all of the cares that your sister needs, does that scare you away from a career in healthcare, or does it interest you?
Oh, I probably know a lot more medical stuff than a lot of people at my school that are in a biomedical program.
Does it make you want to go into the healthcare field, or does it scare you away?
It makes me want to go in more because, I watch a lot of doctor shows with my mom. And 30 minutes before they say the diagnosis, she already knows it. So, yeah, that probably drifts me towards a medical license to get into a medical field.
My oldest one knows he wants nothing to do with medical. Nothing. Nothing.
We have a question here.
Yeah, I was just gonna say, your experience with nurses, is there anything that has been really great they've done that's really helpful, or is there anything they do or say that you wish they hadn't?
Honestly, I haven't run into a whole lot of negative with the nurses. Positive, well, okay, I have had some issues with home care. I won't lie about that. We'll start there and then we'll go positive. Okay. There was a time where Brooke was home on IV antibiotics, and at that point I had given my full trust into them running the IV antibiotics at home. She was home on meropenem, fluconazole, and amikacin. So I was getting zero sleep at night because I was running all these antibiotics overnight. So my home care nurse had come in for the day, and I had meropenem running, and we had to run amikacin opposite way. We were running amikacin. I told her I need to go take a nap. Meropenem was supposed to be next. I came out from my nap, and she had accidentally hooked up amikacin again. So she actually sustained hearing loss from the overdose of amikacin. So that was like a negative. But it's home care is just, I try to advocate so much that there just needs to be more ways to check mistakes, because in home care it's so easy to make mistakes because they're literally going off of a paper bar. You don't have anybody, checking with you on, okay, I'm dosing this medication, is this correct? Do you agree with this? Mm-hmm. You don't have a scanner that says, why are you giving this medication late or early, or, so that's what I run into there. As far as positives definitely have outweighed the negatives. There's been so many times where a doctor has not really listened to me, and because the nurses know her so well, they're able to advocate on my behalf as well. There was a time where she was actually septic. I actually took video of her during an admission over this summer because she had 103.6 fever, and she was sitting up in bed playing with her farm and talking normally, and I took video of this because now anytime a resident comes in the room, I usually show them this video and say, she's used to being sick, this is what sick looks like for her. But back on that, this was an admission a few years ago. I had this overwhelming feeling that, again, there's something not right. I'm like, there's something going on, and the doctor wasn't really listening to me, and it was weekend, overnight shift, and just not listening to me. The nurse, really advocated on our behalf and said, no, there's something not right with her. If mom is saying that, there's something not right. So honestly, we really, when I say you guys are our biggest advocates, you really are. Just especially when it comes to pediatrics, if that's what you decide to go into. If not, there's always usually family there. Make sure you listen to the family if they're telling you that there's something not right. A lot of the time now I'm to a point where I'll tell a doctor if I don't agree with him. But in the beginning of this, I didn't feel like I had that power, and I always looked to my nurses to be that person for me. So it's hard for you guys, right? Because you guys are, kind of the in-between. You're the in-between the doctor and the families. And so you have to listen to the doctors, but just remember the families aren't always strong enough to advocate. And that's what we really look to you guys to do a lot. And I still do to this day, even though I'm a stronger person than where I was when we first started this journey. There are times that I still, I lean on my nurses a lot. And the nurses, like I said, are the biggest, we love our nurses. We love all of our nurses.
Yeah. You said she goes to half-day school. Is there any other places that she gets to be with other kids her age, or do Austin's friends ever come over and interact with her or anything like that?
A couple of his friends are really good at they've known her the whole time, and Yeah, Dylan and Stefan are a couple of his buddies that, are really good at interacting with her. As far as school goes, she is technically supposed to be a 4th grader. She's 10 years old right now. And she functions at about 5 years old. So she's in a program, it's called DCD program. For the life of me, I cannot remember what that means. But she's basically in a very high special needs classroom. So she is with other kids her age, but different functioning levels, basically. She does do dance. She's in a program called Darby's Dancers, so it's also just special needs kids there. And we just got done, was that last weekend or the weekend before? She does a pageant also for little girls that are disabled. It's called Pageant of Hope. And we actually, through dance and Pageant of Hope, were able to meet a couple of other girls that have actually kind of become, us moms are friends, and we try to get the girls together. Those 2 girls have Down syndrome. So she's able to be, hang out with Zoe and Olivia, right? Mm-hmm. Yeah. So we try to get her out as much as we can.
So a question in Rochester, and I believe, is your name Marina? Is that right? Am I remembering correctly, yeah. The nurse? Yes. Hi, good to see you again. Just from your perspective, I'd love to hear, you've been there for a few years now, and I'd love to hear just that process. And, of course, working with Amanda, and just for our nurses that are here, going to be a nurse one day, maybe thinking about home care.
I'm working with Brooke for 3.5 years, and I never knew before that time, I never knew what this home care looks like, honestly. Like, graduating after nursing school, it's hard to find a job, like, without experience. I went to nursing home, and I was working night shift. I got tired. Like, my body couldn't handle it. So, and my friend worked for Bladder company, and she just like, why don't you try home care? I just, honestly, I was scared because I didn't know, like, how can I be with patient one-on-one without any, like, help from doctors or other nurses, like, no team. But I decided to try, and I'm glad I tried. I always want to work in pediatrics. I love working with kids, and Brooke is actually my first client, and now she's only one my client. Yeah, I don't have any other as now.
That was her choice to not have any other. That's so awesome.
Yeah, so I'm kind of a senior, I think, in our team, nursing team right now. I'm working the longest. Yeah, it's somehow professional boundaries are crossed because it's not possible in home care. You are getting friends with the family, and it helps. It helps. We are building relationship. We are so open with mom, and she can talk with me honestly. I can talk with her honestly, It's different than, like, comparing. I originally am from another country, and I used to be nurse over there in a hospital, and I can compare, like, hospital, nursing home. Home care is, like, totally different, and I love it. There's always, like, help from our managers on the phone, and in the case with Brooke, mom is amazing. She knows, like, everything. She took care of Brooke for 7 years by herself, and there's always, you can ask if you need help, and family is amazing. Like, it's easy to be in a house. Like, I don't feel, I can compare, for example, I had another client before. If you're coming, you're kind of feel you're not, like, belonging here. like families, like one part and you are like somewhere in the corner. Just like you understand you need to do something with child, but at the same time you don't feel like you're part of that team. In that house, it's awesome. It's so easy, you know. Boys are amazing. You can always even ask for help if you need to. Yeah. So I wish nursing school offered some like clinicals or at least some visits and kind of like to open the nursing care, like home care for students so they can see. Because some nursing students had like encountered that because of their family stuff or maybe friends, but some of them like me, myself, I never like even like was involved in that, and for me it was totally brand new experience, but I found myself, I love it.
That's the thing with home care, and that I hear from a lot of my home care nurses is you really get that sense of family, and you see our in and out of every day, and there's, you know, if home care is something you're considering, the flexibility. A couple of my home care nurses are LPNs. Well, she can't have LPNs anymore. She's the only LPN she's allowed to have, but she's gotten too complex. But there are RNs that have their 2 years that are working toward their BSN, and it's just the flexibility of home care is just so much more than working in a hospital and even a nursing home sometimes, because we're able to kind of set our schedules. And in my house anyways, and I don't know if that's all the houses, because I do know how to take care of her so well, if the nurses need to leave early that day, I can let them leave early, if, you know, so there's just a lot more flexibility in home care, I think.
Yeah, it's flexible. Schedule is that's amazing for me. Like it works perfect with like managing my lifestyle with kids and everything.
Yeah.
Yes.
So you touched on this a bit earlier, but I was just wondering, like, financially, the support that you got from the county / because you said you've gone bankrupt and you've lost your home.
Yeah.
How did you come back from that, and where did you find help? How did you
I don't know how we came back from bankruptcy. I guess it was kind of, for us, it was a fresh start. We got rid of all the medical bills that she had. And this, you know, had I found all these programs prior to losing our house and filing for bankruptcy, we might not have ever had to go through that. But I think just the fact that I did finally find that is what really helped us come back, because now I had an income kind of coming in again, and, you know, and I wasn't missing work. The only hard part is that when she is in the hospital, I don't get paid because I'm not providing her care. The hospital is providing her care. So we have to plan for that. So luckily, this started a couple of years ago. I think we get paid time off as parents now too, which I basically have sitting accumulating right now, because I know her surgery that she has coming up, she'll probably be in the hospital for a minimum of 10 days. So at least now, I wish I could go and advocate to all the like special needs parents who are just coming into this and don't know all of the programs available, and they are honestly horrible about telling you what's available. You really have to find out from other families. So I try to, if I connect with a new family, I try to really like say, hey, did you know about this and that and this, and they usually don't. So I try to connect people if I can. So. Oh, sorry. I feel so bad. I can't see over the podium.
Developmentally, what does Brooke's future look like?
You know, that's a question nobody's been able to really answer for us. I know I've said this before, but
what are you doing?
That was when we met with genetics for the first time. That was one of our main questions. Where is she going to be? What functioning level will she be at? And they couldn't give me that answer. So I had to, what really helped me is the genetic counselor. Couldn't have said this any better, but she said, to be honest, you really don't know what anyone's future looks like. She said, not to put this too harshly, but you could walk out of here and get into an accident. And honestly, the way that was worded, though harsh, really made me kind of think, yeah, I don't know what my future looks like, you know. The gap with her is getting a little bit bigger because you're getting these, I mean, the kids her age can sit down, read a chapter book, you know, and she's doesn't know the alphabet yet and stuff like that. So it was kind of like this 1 year gap in the beginning, and then it's kind of just, you know, increasingly gotten more and more and more and more. And it's funny because it's something I don't really realize until I'm around an average functioning 10-year-old, and I'm like, oh, okay. Because we've just wrapped ourselves in the special needs community, I think it's easier for all of us to do that because then we don't really know where our child should be at, right? So it's, it's kind of a blessing that I've kind of blocked out where we're at. We really just go to day with her, and we work on what we can, and milestones with her we make a big deal about. She just made a K for the first time in her name really good, didn't you?
Yeah.
Yeah, so, yeah.
I'm not sure if anybody's taken the time, really, Amanda, to compliment you. Just watching you, thank you for your honesty, who you are as a person. And just as I talk about it, makes me want to cry. I know you've been through a lot. And we see that, and for our students, to get this kind of experience, to have somebody come in and be as open as you are about your family life, your marriage, to have a son that loves his sister so much, and a nurse that's saying how comfortable she feels in your home tells me that you're just an incredible person. I want you to hear that, and how lucky they all are to have you.
Thank you.
I say this each year you come. I hope that one day we do get to see you with your RN. And I do really hope that someday we get to have you go to school and do that. And any way that we can help you, we would love to do that. So it's amazing what you do every day.
Thank you.
And keep this family going. So I know it is a lot. They're very lucky to have you.
Thank you. Thank you very much.
Yeah.
I feel I have heard that before, and not that I'm not so thankful for it, but I just I don't know. I feel like any mom would do this, but I don't know. I guess I don't know. I don't feel amazing or special or anything. I just feel like I'm doing what I was kind of meant to do, be a mom and try to do that. I've been able to be more of a mom now than I maybe was prior to having nursing in my home. The nurses have really allowed me to kind of just step back and be mom and not have to be the one doing all the medical interventions, which has been a blessing for us.
Mm-hmm.
Yeah.
Yeah. Do you go and talk to other groups as well? And how did you get connected? Barbara and with other places?
So we started talking. I was actually approached by, and I don't know if he's here, Jihad.
Yeah, he's not
Is
here
he back
anymore.
again?
He's not with his university.
He didn't come back. Okay,
No.
so he's back on the unit. He's back on Unit 5.
he's back
He
in
did
the
come
States,
back.
yeah.
So I actually got connected with, he was a professor, a nursing professor, probably about 4 or 5 years ago now, I think.
Yeah.
He actually approached me after I had just taught a room of resident doctors how to put a G-tube in. So I had Brooke laying in the bed and all these doctors surrounding me, and I'm showing them how to put a G-tube in because none of them had any clue. And he approached me and just asked, he's like, hey, we read this book, Wonder, and I was wondering if you'd ever be interested in coming and talking. So this is the only place I do it for. We love it. We've missed, multiple things just because of her being sick. She sees herself in the camera. So yeah, I really, really enjoy doing this, and I really enjoy just having it be open forum because I don't want to talk the whole time, Well, I mean, I guess I do talk the whole time. I like the questions. I like being questioned. So. You found yourself in the camera, didn't you?
I know you had said you have like 16 specialists. How do you keep track of all of that?
I have a color-coded calendar with both the boys and sports, and well, now it's so much easier because we have my chart, right? So I can just put it in my phone, and the appointments are all in my phone. But I literally have to write everything down. I'm a very visual person, so I don't use my calendar and my phone like the whole population does. I have a planner that I keep everything color-coded in and write in, and yeah. On top of all the appointments, she has therapies too. So we actually were just discharged from speech therapy and occupational therapy not that long ago. But she still does physical therapy every week, and then we have dance every week. And then all of the specialists were usually following up every 3 to 4 to 6 months, just kind of depending on what specialist it is.
IVIG every 3 weeks.
Oh yeah, she gets home infusions as well every 3 weeks. She has a common variable immune deficiency as well, so she gets IVIG infusions every 3 weeks at home. We do it at home, so they're actually coming today after we're done here.
And how old is Austin? Austin, how old are you?
I'm 15.
15.
Freshman in high school.
Wow. How's high school going?
Sorry.
It's okay. Go ahead.
I just wonder if Brooke has anything that she wants us to know about her, or as nurses, what we can do for her, or people like her in the hospital.
What do you think, Cynthia? Did you hear that? Yeah. What do you like your nurses to do? That's kind of a hard question. What do you like your nurses to do with you?
Play.
You like them to play. Yeah. Nursing for us, the best thing we've found is because she has people coming at her all the time, I kind of got to a point where I was noticing like she really had no self-control over her own body, if you just put yourself in her shoes for a minute, and literally people coming at you all day, every day for your whole life. I mean, there are times where she gets frustrated, and that's okay. I mean, we would too, So I've figured out that prior to us just touching her and going through the motions of doing stuff with her, that we really try to communicate with her, like, this is what we're going to do. And I ended up coming up with the idea of setting a timer, just so that it gives her some control back of her own body, because I want her to feel like she has self-control of her body, So that's been really good for us. So she likes when the nurses set timers, right? And when they don't just touch you right away. So and I kind of thought back to days even when I was a nursing assistant, and I caught myself just really going through the motions and like, okay, I'm going to change your brief now, and I would just start doing it, and I had to take a step back and look at myself as a person, and if I would like that, I mean, this is happening on a daily basis, but that doesn't mean you shouldn't let someone know before you touch them. You wouldn't just you wouldn't like if someone came at your face or your body and just, you know, came at you. So we like that, right, Ricky?
Also, we like to give her choices so she can, like, what do you want to do first, that or that? What do you want to wear, for example? What do you want me to dress you, like, top or bottom first? So she can kind of feel that she's controlling, not us.
It's good. Good choices. Did you pick out your glasses, Brooke?
What?
Did you pick out your glasses?
Did you pick out your glasses?
Yeah.
Yeah, they're nice ones. I like those.
Yeah, this morning Mom was offering her what do you want to wear, like t-shirt and pants or dress. She's choosing. So she loves that.
We'll talk about your shirt. What's on your
Yeah.
shirt?
A guinea pig.
A guinea pig. And your shoes. And your shoes. Yeah.
Why? Can you
say that? Say that.
Good job.
She was gonna say it. Let her say it. Go ahead.
A guinea pig mama.
She's a guinea pig mama.
Do you want to tell them a joke? You told them this morning.
Joke.
A joke. Ask them a question.
Do you remember it?
What does a guinea pig look like?
What does a guinea pig look like?
They
A
know.
furry potato.
A furry potato.
What's your guinea pig's name?
Lammy.
Lammy.
What's your fish's name?
Lammy.
We didn't hear that. What did you say?
Lammy.
What's the fish?
Lady.
They're
fish's
both
name is
named
Lammy.
Lammy.
Oh, gotcha.
What?
Any other questions? Any other questions in Rochester?
Nope, they're saying they're good.
Okay. I think we are here also, so just want to reiterate how much we appreciate you taking time out of your schedules to visit with us and kind of give us a peek into your daily lives. And Brooke, it's always good to see you, especially laughing and telling us jokes. Lots of fun. And Austin, it was great to meet you.
You too.
And look forward to, fingers crossed, doing this again soon, maybe in the fall.
Yeah.
It's raining.
I know it's raining. It's raining up here hard. I don't know what it's doing in Rochester, but we have a very dreary day here. But anyway, I'd just like to give you all a round of applause and thank you very, very much. And, do you have anything else, Dr. Summerness?
No, I think we're good. I just thank you again. We'll keep in touch.
Yeah, perfect. Thank you very much, you guys. I love doing this, so thank you for your time in your class.
Did you like the joke?
She said, did you like the joke?
We did. We were giggling. We thought it was perfect.
All right.
And I do want to say you're a very good mama, too, because you're loving that baby.
Guinea pig.
Yeah.
Lammy.
Yeah. All right. You ready to go?
Yeah.
Yeah.
In the rain?
In the rain.
All right, so that's it for class as far as I'm concerned, Dr. Summerness. How about you?
Because I am hungry.
Brooke's hungry.
Yeah.
You're going to talk about
Dula.
the doula part.
Yeah. Yeah, I think we have lunch, right? Or something.
We going to disconnect? Sam? Can you
We
hear?
should be disconnecting, yeah. We'll go
Okay.
ahead. Yep.
Everybody in Rochester, have a great day. We'll see you next week. Take care.
Thank you.
It is so good to see you smiling and happy and just telling jokes. You let us know how things are going with you. I like that joke.